Speaking of that, we got Dr. Fauci. Dr. Fauci, as you know, he told people, he lied to people. He said, don't wear a mask. It doesn't help you. In fact, he went even further and said it could be detrimental. He knew he was lying when he said that. And the reason why he lied when he said that, he then said, was because we were afraid that people would go out and get masks and there wouldn't be enough masks for our hospital workers. So that's why I lied and said, don't wear masks. That guy's not canceled. He didn't get kicked out of his job. That guy didn't get censored from YouTube. He didn't get kicked off Twitter. He lied about wearing masks. And here is Mehdi Hassan. He's going to confront him about it. Watch this. Mehdi Hassan either watches this show or I'm sure his producers do. Here we go.
Let me ask you this one other question about the past, because you said we need to move forward. I agree with you. And one of the problems we have now is we have a lot of people, bad faith people, saying we don't trust Anthony Fauci, we don't trust Joe Biden, we don't trust the scientists. But there are others who, in good faith, just genuinely over the last year, and I think you've recognized this in the past about the mixed messaging and some of the different advice they've gotten on this very thorny disease. I want to play a clip of you speaking to 60 Minutes just over a year ago. Have a listen.
Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask.
So he's not getting it wrong. He's not misinterpreting data. He's not operating off of bad information. He knows exactly what he's saying is untrue, and he's lying to you, and that's going to probably kill some people. So a lot of people probably got killed because they didn't wear a mask because Fauci told them that it wasn't going to help them. There's nothing more insidious or more immoral than a doctor telling you on purpose bad information that could kill you. And that's what Dr. Fauci's doing right here. And the 60 Minutes guy says, are you sure about this? Because everybody's watching you. And watch what he says.
When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course. But when you...
Yeah, she gets some schmutz, some shugana, some bupkis. She gets the valklenkda. You kiss the peppy, the caca. You get the schmutz. So there he is. By the way, again, that's blatant lying. How is that? That's horrible, because when Trump would lie about the vaccine, it was less horrible because nobody trusted him. Everyone trusts this guy. He's a doctor.
Given you acknowledged in that clip in March 2020 that Asian countries were masking up at the time, saying we shouldn't mask up as well was a mistake, wasn't it? A huge mistake at the time, not just in hindsight.
No, I keep seeing that clip getting played over and over again. So if you could give me 15 seconds, I'll go right back at you with this. Okay, at the time, three things were going on. We were told very clearly at the Coronavirus Task Force, including by the Surgeon General, who's a good person all the way, that there was a clear shortage of masks. And if we went around recommending masks, the healthcare providers who were putting themselves in harm's way.
So he's admitting that we couldn't tell people to go wear masks and protect themselves because our healthcare workers needed those masks. So we told people masks didn't help. And that was a lie. And he's acting like it's okay. Look, our healthcare workers needed the mask. So we lied to the American public.
Who were putting themselves in harm's way every single day would not have enough. Point number one.
That's why they did it. That's it. That's why he lied. He decided that you could get sick and die, but a healthcare provider couldn't. I'm all for making sure healthcare providers have masks. You know how you do that? You declare an emergency and you make the country make enough fucking masks. We're the richest country the face of the earth has ever seen. We can make enough masks. That's what you do. You declare an emergency and you tell everybody, make your own mask. And the medical grade masks we're going to give to the healthcare workers. Everyone else can wear a mask. Make your own mask. That's what they should have been doing. They didn't do that. What did he do instead? He decided to lie to you, so you thought masks didn't work, and so you went out and got sick and died. Why? Because your life isn't as important as some other people's lives, and they're going to lie to you. No matter what the reason, a health official on purpose lying about a life or death issue, as a matter of policy, that guy should be in jail. Not only should that guy be fired and canceled, he should be in jail because people died because of that. Here's his other two stupid things he says.
Point number 2, there was no evidence at the time that masks outside of the setting of the hospital worked. There were no data to show that. Number 3, we did not know that at least 50% of the infections were being
How could that possibly be? That there was no data? All of Asia is wearing a mask, but there's no data on wearing masks and how they could stop it? What are you crazy? Of course there's data.
Yeah, I mean, we've been studying, and we being, science all over the world has been studying what cloth coverings do in terms of droplets for a very, very long time now.
Long time. That's why doctors wear masks, dummy. Because we've studied it.
Asymptomatically, namely by people that had no symptoms. That's the reason why at that time I and others made that statement. Fast forward a month or two after, it became clear there was no shortage of masks. In fact...
so again, that's the real reason. There was shortage. It had nothing to do with there's no data. It was that you guys were afraid there was not going to be enough masks. And then as soon as there were enough masks, all of a sudden we got data. And if you don't wear a mask, you're a bad person.
Cloth mask works. B, we started to see rather substantial data that masks outside of the setting of the hospital work to prevent infection and to prevent you from infecting somebody else. And 3, we found out to our horror that 50% or more of the infections were transmitted by people who did not know they were infected.
Yes.
That's the reason why I changed. So, wait, let me just finish.
No, that's not the reason why you changed, you liar. The reason why you changed is the first thing. The masks that you thought weren't going to be enough. You thought we weren't going to have enough masks. So you told people, don't wear masks, even though I know you should, and you're going to get sick and die. Don't worry about it.
Because you showed the clip. First of all, if something is static and you change your mind about it, you're flip-flopping. If something changes, the data change, and you change with the data and rely on the data.
The data didn't change.
You're not flip-flopping.
Everyone knows masks work. Masks have always worked. You're a liar. The only data that changed is you guys figured out there was enough masks to go around, so you then told people to wear masks. Mehdi Hassan, thanks for watching our show and asking him that question. I'm sorry you didn't ask a follow-up question. By the way, Mehdi Hassan, who has me blocked over Syria because he was wrong about Syria and Cy Hirsch. This guy, Mehdi Hassan, takes a shot at Seymour Hirsch. This fucking guy, this piece of it. And that I bust his balls for it, so he blocks me now on Twitter because I told him the truth about Syria he didn't want to hear. He's very pro-war, Mehdi Hassan. I wish I had more time to dig into this, he said. Oh, I wish you did too, Mehdi. Just too bad you don't have time on your own fucking show to ask a question you want to ask. I wish I had more time to dig into this. He's right. Lack of medical-grade masks for frontline workers and lack of hard evidence. But why rule out any masks, even cloth, so forcefully? Why ignore Asian countries' use of the precautionary principle and experience with SARS? So so you're telling me, Mehdi, there's no hard medical evidence that masks help with SARS? That can't possibly be true. So, and here he goes. Here he is.
So you shouldn't discount that. Now, getting back to your first question, which was, what about a month or so, or 2 or 3 ago?
So, by the way, all that other stuff up, he just made up. Again, here's the real reason. Here, I'm going to play it to. Here's the real reason.
When people were saying, you don't really need to wear a mask. Well, the reason for that is that we were concerned, the public health community, and many people were saying this, were concerned that it was at a time when personal protective equipment, including the N95 masks and the surgical masks, were in very short supply. And we wanted to make sure that the people, namely the healthcare workers, who were brave enough to put themselves in harm's way to take care of people who were infected with the coronavirus and the danger of them getting infected, we did not want them to be without the equipment that they needed. So there was not enthusiasm about going out and everybody buying a mask or getting a mask. We were afraid that that would deter away from the people who really needed it. Now we have masks. We know.
So there, where's point 2? Where's point 3? Where's point that? None of that was all that stuff he just said to Mehdi was made up after people realized this was a bullshit reason. So then he had to make up all that other stuff. This is the real reason. All those other things may exist. They found out about asymptomatic carriers or whatever. That might have actually happened. That had nothing to do with his decision. This is the real reason. Why wouldn't he tell that? Why wouldn't he say all that other shit when he was asked? He was asked. He said this, and he got unbelievable pushback from me on this. I guess hopefully other people. And now he came up with another bullshit lie.
That you don't need an N95 if you're a ordinary person in the street. We also know that simple cloth coverings that many people have can work as well as a mask in many cases. So right now, unequivocally, the recommendation is when you're out there, particularly if you're in a situation where there's active infection, keep the distance physically and wear a mask. So although there appear to be some contradiction of you were saying this then and why you're saying this now, actually the circumstances have changed.
Did not
That's
change.
The reason why.
Did not change. Circumstances did not change. You guys just figured out you had enough masks for the hospital workers. That's what happened. Here's another thing he lied about. Again, didn't get it wrong. Didn't make a mistake. He intentionally misled you for months about how much herd immunity do we need. Scientists initially estimated that 60 to 70% of the population needed to acquire resistance to the coronavirus to banish it. Now, Dr. Anthony Fauci and others are quietly shifting that number upward. So when he first started talking about how many, we're going to need 60% of the people to have immunity for us to have herd immunity or resistance, in a telephone interview, Dr. Fauci acknowledged that he had slowly but deliberately been moving the goalposts. And here he is asked about that.
Discussion like we're having now, Dana, to encourage people to get to that goal of 70 to 85% of the people vaccinated. That
70 to 85%. He started out by saying 60. Now he's saying up to 85% need to be.
Let's talk about some of the solutions in terms of coronavirus. You acknowledged to the New York Times that you've moved the goalposts in terms of what it would take to reach so-called herd immunity in the United States. Here's what you said. You said when polls said only about half of all Americans would take a vaccine, I was saying herd immunity would take 70 to 75%. Then when newer surveys said 60% or more would take it, I thought I can nudge this up a bit. So I went to 80, 85. And then you go on to say that it may be as high as 90%. So my question is, why weren't you straight with the American people about this to begin with?
No, actually, Dana, I don't think it can be interpreted as being straight or not. We have to realize that we have to be humble and realize what we don't know. These are pure estimates, and the calculations that I made, 70, 75%, it's a range. The range is going to be somewhere between 70 and 85%. The reason I first started saying 70, 75, I brought it up to 85. That's not a big leap to go from 75 to 85. It was really based on calculations and pure extrapolations from measles. Measles is about 98% effective vaccine. The COVID-19 vaccine is about 94, 95%. When you get below 90% of the population vaccinated with measles, you start seeing a breakthrough against the herd immunity. People starting to get infected like we saw in the upper New York State and in New York City with the Orthodox Jewish group when we had measles outbreak. So I made a calculation that COVID-19, SARS-CoV-2, is not as nearly as transmissible as measles. Measles is the most transmissible infection you can imagine. So I would imagine that you would need something a little bit less than the 90%. That's where I got to the 85. But I think we all have to be honest and humble. Nobody really knows for sure. But I think 70 to 85% for herd immunity for COVID-19 is a reasonable estimate. And in fact, most of my epidemiology colleagues agree with me.
Yeah, of course. Nothing is exact. I guess my question was about polling. It seemed in that quote to suggest that you were basing your recommendation on polling and what people could accept. Is that not what you meant?
No, I mean, it's a bit of that. I want to encourage the people of the United States and globally to get vaccinated because as many as we possibly.
No, it's a bit of that. So that, no, I mean, yes. No, I mean, yes, yes, yes. Is that not what you meant? That thing you said when you said that now that the polling indicates I can probably bump that number up because more people, that's what you meant, right? You mean what you said and what's clear what you said, that's what you meant? No, I mean, yeah. This fucking guy is the biggest liar in the world, and he gets away with it because he wasn't Trump.
Get vaccinated will get closer to herd immunity. So the bottom line is it's a guesstimate. I gave a range, and I use any discussion like we're having now, Dana, to encourage people to get to that goal of 70 to 85% of the people vaccinated. That's where we really want to be.
Okay, and just to put a button on it, no sugarcoating, you're saying 75 to 80% is the goal, in your view, as of now, based on what you know when it comes to herd immunity, not 90%.
Not 90?
Right.
Okay. Thank you.
Because he started out saying 60, ended up saying 90, and now she's like, now you're saying 75 to 80. Right, not 90. Right, okay. You're going to make, if the polls change, you're going to change your answer on the science? Probably. Probably. Ron, any, I just can't wait to see, Pacino's going to play him in the movie. That's going to be fun.
Are you serious?
No,
Is that a real thing?
No, I'm guessing.
Oh,
no.
I thought that was like a thing they're already planning.
No, that's me guessing.
It's very frustrating because it's like you listen to this guy and you're just like, dude, you're not giving a cake recipe. We're in a freaking pandemic. This is a little more serious. It's like, you could put in a cup of sugar or a cup and a half. Like, no, give us. Why didn't you just say the first time? And why not aim high? Why not say, hey, based on comparing it to measles, we don't know for sure, but we should shoot for 75 to 90%. Why didn't you just say that the first time? Why didn't you just say, make your own mask? That's what most people did anyway. And it's like, it is a lonely place. And I know I don't need to tell you this, but it's a lonely place when you're criticizing this guy from the left because he gets lionized and treated like this deity just because, the Trump administration was a total circus during the whole pandemic, which they were. That's totally true. But that doesn't mean that it can't also be true that Fauci isn't so great either. Both of those things can be true. I know that we all grew up on comic books, but there is a reality where there really are no good guys. And this guy can't resist genuflecting at the altar of capitalism. And that's a frickin' problem. This guy, when he was asked about the price caps for vaccines, he wasn't for it. And this is another guy, and I know he's not directly a policy guy. I know that. But still, given his position and the amount of influence he had, he could very easily say, you know what? You know what would make my job a lot easier? If we weren't behind the rest of the industrialized world by decades when it comes to healthcare. But he never does that. In fact, when he's asked about universal healthcare, I don't know if you've ever seen some of his videos on that, but when he's asked about universal healthcare, he sounds as if someone asked him if he would like a new car. Like, oh, that'd be neat. Yeah, that'd be cool. What do you think if we could have that? Meanwhile, a third of all the people, it's estimated that a third of all the people who died from COVID and COVID-related deaths would still be here if we had universal healthcare. And Anthony Fauci, because he genuflects at the altar of capitalism, which is probably required to keep his job in a place like the United States, and because he does that, he won't come out and say that. So yes, he is a very frustrated figure at this position.
I got called in when I reported on him lying about the masks the first time. I had to have a meeting with the GM and the program director of KPFK, which is where our show used to air for 10 years or over.
Public radio. Pacifica
Radio, right? Which I was it was created. Pacifica Radio created to combat the Cold War, and then KPFK turned into a bunch of McCarthy smearing morons. It's just unbelievable what happened. I was, again, one of the lone voices over there. And so I got called in because I was reporting this accurately, that Fauci's lying about masks. Now I sound like Joe Biden.
Joe Biden called.
I sound like Joe Biden. I got called into I had a meeting. They're like, "Hey, we got what are you doing?" I go. I know you guys aren't really up on the news, but that's an accurate fucking news report I did. Do you have a problem with the facts? If you have a problem with the facts, let me know. If not, I'm hanging up. And I hung up. And my show was we soon left KPFK thereafter. The program director got fired, and then the GM left.
But did the GM go
The GM
somewhere interesting?
went right to KCRW, no problem. He went from KPFK to KCRW with no problem. There's supposed to be a big problem. So if you're at KPFK, you're supposed to be the leftiest of the lefties. But that's not what it is anymore. Just because you're a hippie doesn't mean you can't be a McCarthy smearing neocon. Anyway. That's that. That's sad. So yeah, that's happened to me because I reported this accurately. Even CNN is pushing back against this guy now. Even CNN. That's how bad the Fauci guy is. So there you go. I would get flack no matter where I tell the truth. You're going to get flack. I get flack at the Young Turks for telling the truth about Syria. I got flack at the Young Turks for telling the truth about Julian Assange when they were smearing him. I got flack at the Young Turks when I was telling the truth about Russiagate and Bill Binney and the servers and the election interference. I got flack from the Young Turks. They turned their back on me for doing good work while they were McCarthy smearing people. And I got flack also at the KPFK for doing good work on Fauci. You're going to get flack if you do good work. That's just what in journalism. If you don't want to take flack, go work for The Intercept and fucking do puff pieces for Chuck Schumer. Nothing's going to happen. Hey, everybody, this is the part where I tell you where all our live shows are, but there aren't any. And then this is why I tell you to join our premium program and get extra content, but nobody's got a fucking job. So just enjoy the video.